Bozeman was 43 years old on Friday when he died of colorectal cancer. I spoke with our medical expert, Dr. Cedrek McFadden, about how common this type of cancer is in young people and the warning sign that many ignore.
Dr. C, thanks so much for joining us. The recent news that the death of Chadwick Bozeman is such a tragedy. And, this is happening more and more in young people. But first, let's talk about the warning signs with colorectal cancer.
So there are several of those. And when people come into my office and we ultimately find that they did have colorectal cancer as the problem, there's several things that they may complain of. One of which is rectal bleeding. They may see bright red or dark red blood on the stool, on the toilet tissue, or just in the water of the toilet bowl. They also may complain of a change in their stools. Perhaps their stool has changed size, perhaps it's changed shape or the consistency. Perhaps they're more constipated, or perhaps they're just having a fluid diarrhea as opposed to what they were having before. They also may complain of mucus in the stool, which is sometimes a surprising finding for patients that come in. Additional complaints include abdominal pain, changes in their weight, primarily weight loss that they can't explain. They didn't plan to go on a diet, but all of a sudden they've been found to have a 20 or 30 pound weight loss. And obviously that's a red flag that something could be going on.
I was reading a little bit about this, and I know it's not the most pleasant thing to talk about, but the blood in the stool, and that is something that young people tend to ignore when they see it.
Yeah, people tend to ignore it because there are other things that we've been programmed to think that it is. Perhaps we think it is primarily hemorrhoids, and hemorrhoids get blamed for primarily every problem that we see in the office. But bleeding, even if it is from the hemorrhoids, is still not normal. It's common, but it's not normal. And so if we're treating those hemorrhoids and the bleeding is still persistent, we have to dig a little bit deeper to see if there's something else that's going on.
Some life-saving information right there. I hope folks can hear that. What are some of the reasons behind this trend of young people with colorectal cancer?
Well, the short answer is we don't have a definite answer, but there's several possibilities that are on the table. Number one is we think about the increased rates of obesity, the decrease in activity or exercise. That certainly may play a role. Additional things that we have talked about is diet changes. Diets that are high in processed meats, high in fats, high in sugars. That can also play a part. There's also the genetic risk, and we've been talking about more recently in some of the research is the influence of the gut bacteria and whether or not this flora of bacteria in certain people may make them more susceptible or more prone to develop things like colorectal cancer. And so that's some of the conversation about what may be going on. But the answer is it may be one, it may be both, it may be a collection of several of those reasons together.
And are those the groups that you speak of? Are there certain groups of young people that are more at risk than other young people? And by young, I would imagine we're talking about people even around the age of 40.
So under the age of 50 is what we've been classifying as younger age, because remember years ago, probably 2 or 3 years ago, the overall recommended age to begin colonoscopy was the age of 50. And probably 3 years ago, 2 or 3 years ago, I believe the American Cancer Society changed their recommendations, with several other societies following that those recommendations should be at 45 years old. African Americans have a higher risk of colorectal cancer and certainly a higher risk of colorectal death from this type of cancer. But aside from even those risks, people who have personal history of problems like Crohn's disease, inflammatory bowel disease, or even family history of colorectal cancers or polyps may be at a higher risk of colorectal cancer.
Okay, and we have about 30 seconds left. What are some of the barriers to people getting tested? Because testing is really the key to fighting this, getting it early.
Correct. Well, some of the barriers, very briefly, primarily include, number one, recognition, thinking of that diagnosis as being a diagnosis or potential cancer and going forward. Not all bleeding is related to cancer, but it certainly should be a red flag. Additional barriers include the cost. We're having patients come in and say, well, my insurance is not going to pay for this because I'm a certain age or don't have such and such problems. That can be a barrier. And general access to care, access to really good quality medical care, or doctors that are listening to you, are really taking your concerns seriously. Those can definitely be barriers that can get in the way of getting early diagnosis, which we know the earlier we diagnose this, the better your chances are of long-term survival.
All right, some important information. Dr. C, thanks so much for joining us.
Thank you, Ben.